Welcome to one of our exam rooms. One of the most important parts of understanding where low back pain starts with a good detailed consultation and a really good exam. Let me explain. The consultation is where I'm really passionate about to get to know each individual. This is where I get to know what you do on a daily basis, what may be contributing or adding to some of the back pain. Getting to know you, your health history, and everything that you've been through, past traumas, really important. And then most specifically, how your pain is impacting your life. This gives us the why behind a lot of the treatment, trying to understand what the motivation is. Is it just to get out of pain, or is it to get to a deeper rooted aspect of your back pain and find the problem behind that pain so we can treat it more accurately? One of the things that I think is missed in healthcare system today is a really detailed examination, and that's where we dive in. A lot of doctors don't use orthopedic and neurological testing as much as they should. We rely too much on sending people out for expensive MRIs or expensive lab testing, when a lot of times a good orthopedic or neurological test can identify and start to narrow down the root causes of low back pain. Specifically, if there's pressure on a nerve, that nerve sends a signal down your legs. We can do deep tendon reflexes and muscle testing to be able to identify where some weaknesses might be. We get to know and narrow down if it is a disc that's involved, whether it's tendon or ligament or muscle. There's a lot of different things that we can narrow down with a good neurological and orthopedic evaluation. And so this is why we dive in on your first visit in a room like this to be able to get everything. Of course, doing some of the basics that's the standard of care with blood pressure and heart rate and pulse oximeter, getting your oxygen saturation levels and all those types of things are just some of the standards. But it's the deep dive that gets into the root cause of your back pain, getting to know you, getting to know what you've been through, your past history, your traumas, and then diving in with the really should be the standard of care with really good orthopedic and neurological testing that guides me and you down the path of really trying to get to the root cause of your problem, or in other words, the root cause of why you're having pain.